So now I would like to introduce the next speaker. This is Dr. Tuan SUHAILA Tuan So, who is from the Sungai Buloh Hospital. Dr. Tuan SUHAILA is a clinical microbiologist and she has sub-specialization in infection control. And she's part of the infection control team at the Sungai Buloh Hospital in Malaysia. This Sungai Buloh Hospital is a designated COVID-19 hospital. So we call on her to give her presentation called Molecular Testing of COVID-19, the Sungai Buloh Experience. Welcome, Dr. Tuan SUHAILA.
Good afternoon, everyone. Thank you to the organizers for giving us in Sungai Buloh the opportunity to share our experience in handling COVID-19 test. So, okay, that's my next slide. Okay, so as an introduction, coronaviruses, these are respiratory viruses which belong to the family Coronaviridae, which is an enveloped single-stranded RNA viruses. These viruses are zoonotic with reservoir in animals. One of them is thought to be bats. There are 7 types of coronaviruses identified in human, can be divided into alpha and beta coronaviruses. For COVID-19 or SARS coronavirus 2, these belong to beta coronaviruses, similar to MERS coronaviruses and also SARS coronavirus. So because of that, they share similar clinical features. The infections caused by SARS corona, MERS-CoV as well as COVID-19, they have similar clinical features and they infect both upper and lower respiratory tract and also gastrointestinal tract. So in general, for lab diagnosis of coronaviruses, we have molecular method, antigen detection, as well as antibody detection. I believe Dr. Donna Huda had spoken in great length on the antibody as well as antigen detection. So for my part, I will just briefly talk on the molecular method. So for molecular method, it is basically detection of the presence of viral RNA in samples. Example of molecular method is real-time polymerase chain reaction, which is what we are using in our lab. Another molecular method is whole genome sequencing, which is used to determine the sequence of the SARS coronavirus 2 or COVID-19 virus in samples, and this is used mainly for strain identification. So our journey in Sungai Buloh started in early January 2020. Okay, so the lab preparedness started early in 2020. So we had various meetings at national level, state level, as well as hospital levels. We've been identified as one of the designated labs for COVID-19 tests. And we are the only one doing the test in Selangor at that time. Okay, so in the meetings also we also discussed on stockpiling of the reagents, consumables, and also analyzers, and also staffing issue, and we also went for training by IMR to carry out the test for COVID-19. And finally, on 21st of February, we finally started our COVID-19 test using the starter kits, i.e. the primer and the probes provided by IMR using the protocol shared by WHO. So just to show you some pictures, so this is one of the earlier training sessions in IMR, the NIH in Setia Alam. And this is just again the training session, the going through the theory, as well as the practical part of the training. So initially in Sungai Buloh, we only had 5 samples, all from our inpatients. But after 10 days, the number of samples increased tenfold. Okay, as we started to receive samples from 7 other hospitals in Selangor. And the number of samples kept increasing from February, March, and peaked around April, with the average samples that we received during those months, 350 to 450 samples per day, with the highest number of samples we received was nearly 900, it's 886 samples. Okay, so this is just to show the trend of the number of samples. So from February and March, around 7,000. And then the blue line below is actually the monthly number of samples, whereas the orange one is the cumulative number of samples. So in total, from February until August, we have tested around nearly 40,000 samples. Okay, and again, our peak was in April, with the sample number around nearly 13,000, and it had decreased in May, and now July, August, it had somehow plateaued. Okay, so now for July and August, our average samples is 150 samples per day. So the reason being is that other than the number of cases are also decreasing, okay, have come down, there are also more labs doing the test. So initially, we started off with 17 labs, okay, IMR, which is our reference lab, the Institute of Medical Research, and also we have other, we have National Public Health Labs, and also other hospital labs, Ministry of Health hospital labs. But now, as of August, we have a total of 56 labs. Okay, in addition to the existing ones, we have ATM labs, universities, and other ministry, which is MOSTI, as well as private labs are also on board in doing COVID-19 molecular test. Okay, so that's why, for example, in Selangor, there are also other labs going to start the testing soon. So that's why our number is a lot less nowadays. Okay, so for COVID-19 test in Sungai Buloh, if you look at the picture, this is how our staff, this is what they wear during when handling the samples for COVID-19 test. So they must wear full set of PPE with the gloves, gown, shoe cover, N95 mask, and together with face shield. Okay, so this is our extraction lab actually. So the sample types, we receive upper and lower respiratory tract. So for upper respiratory tract sample, we receive a swab, which is the nasopharyngeal swab, and also oropharyngeal swab. For lower respiratory tract, we receive nasopharyngeal aspirate, tracheal aspirate, as well as sputum. So the steps involved are, for samples that arrive at the lab, it will be processed. We subject to sample processing. So what it means is that there are lots of demographic work involved. Okay, meaning keying into the system, giving registering the sample in our lab information system, giving the barcode, labeling the tubes and all. Next is the RNA extraction from the sample, and this can be done manually, also automated, using automated extraction. So depending on the number of samples, the sample processing and the RNA extraction can take up to 3 hours. Okay. Next is the preparation of reagent or master mix. So this will usually last for 1 hour, and then we have mixing of reagent with the extracted RNA, and then we load the samples in the thermocycler and run for 2 hours. So in Sungai Buloh, for the real-time PCR, the run time is actually normally 6 to 8 hours, but it can be longer if we need to repeat the run for maybe the first run failed because of a technical issue, then we need to repeat another run. So for turnaround time, we will say the PCR from the time that we receive the sample in the lab until the result is given out to the clinician, it will be 24 hours. And for the detection of COVID-19, we do minimum two target genes detection using test kit, which have been evaluated by our reference lab, which is the IMR. Okay, so again, more pictures for you. So this is our sample processing in the extraction room. So all the samples will be in this white polystyrene boxes. Okay, so one box can have maybe 5 to 6 samples. Okay, and then our staff, our medical lab technologists will open the box, take out the samples, check the request forms, to verify the information and do all the demographic work here. Okay, there is a PC. And then here the samples will be processed in the biosafety cabinet. So the staff will have to wear full PPE and process the samples in the biosafety cabinet. So here they are doing RNA extraction manually. Okay. Next, okay, here again, this is the extraction, manual extraction. On the right side here is the automated extractor. So if we are talking about 200 to 300 samples per day, so definitely automated extractor is a big advantage. And so for extraction alone, it takes up to 2 to 3 hours. Okay, then this is PCR. Okay, this is where they mix the reagent together with the extracted RNA and load into the thermocycler and run the PCR. Here is the graph or data analysis. Okay, so we will look at the amplification curves and see whether they are of the sigmoidal shape and check all the parameters before we can accept the run and verify the result. So this is the process of reporting of results. Again, the result will be the demography of the result. It will be entered in the hospital-based system, reporting system, the lab information system, as well as the SINCA, which is the online national public health lab system. So and this is one of our clinical microbiologists verifying the results and release into the information system. So that's our molecular test. Just briefly, for antigen, in addition to the molecular, in addition to PCR, we also do antigen detection here in Sungai Buloh. So we do rapid test rapid test antigen, which is immunochromatography based. The runtime is around 30 minutes, but turnaround time is 4 hours. This is because we take into account the time that the sample received. We need to do the demography of the sample, and then before we can give the result to the clinician. So when do we decide? How do we decide when to do rapid test or antigen, or when we do PCR? So this is we follow the guideline for COVID-19 testing using antigen rapid test kit. Okay, so if they fulfill the indications outlined in the guideline, then we will do the rapid test kit. For example, if cases of brain death, for forensic, or for pre-operative screening for emergency and semi-emergency cases, as well as for a screening in certain populations, or use screening in EMCO, or enhanced movement control order. So this will be indicated for rapid test kit antigen testing. So other than doing the giving the diagnostic service, we are also involved in some studies. So I'm going to share 2 studies done so far. So the first one is study on the RTK rapid test kit antigen versus the real-time PCR. But this is only a small study. There were only 12 samples. So we, for those RTK antigen positive, and then we will do the PCR as well. So the result is that we found only 60% positivity when we repeat the PCR. So this is in line with the recommendation in the guideline just now that I showed you, that RTK antigen should be used for screening, but you need to confirm with RT-PCR, especially in low prevalent population. Okay, next study, this is quite recent. This is a COVID-19 antibody response among RT-PCR confirmed COVID-19 patient in hospital Sungai Buloh. So my colleagues here, my fellow presenters, are also involved in this study, so they can tell you that the antibody test for COVID-19, they are not for use in acute clinical care settings, okay, but they can be, because antibody can only become positive in the later phase of illness. Okay, so for acute diagnosis, you should still go for molecular as well as antigen. Okay, in the last few slides, I'll just share with you what are the challenges that we had faced so far. So number one is to ensure adequate supply of reagents and consumables. So when we first started, there was a huge pressure, a tremendous pressure on us to produce the results within the stipulated turnaround time of 24 hours. As you can imagine, we received a lot of samples from Selangor, okay, up to 800 during the heyday, during the peak. So all the results should be released within 24 hours. So initially we had some difficulties procuring or purchasing the reagents and consumables, okay, as the available or existing stocks were limited. The manufacturing and delivery of these reagents and consumables were also hampered by lockdown situations, okay, or controlled movement order in many countries, including Malaysia. Okay, the companies basically they cannot deliver because they because of the lockdown and the restricted movement. So fortunately, the MOH, the team in MOH had helped us by centrally coordinating procurement of the reagents and consumables. So they ensure the supply, the disruption in the supply of reagents and consumables are very minimal. And I must give credit to our pengarah, our hospital director, Dr. Kuldeep, who has been very supportive and attentive from day one to our problems. Okay, so she basically was involved in whole process of procurement, and also by giving her full attention and commitment in ensuring that the working condition in the lab is improved. For example, by installing enough air conditioners in the lab so that the staff who is in full PPE handling the samples, they can be quite comfortable despite having to wear the PPE for a long period. So I must say a very big thank you to my pengarah. And after about 2 months of starting the test, we managed to reach our maximum testing capacity of 400 samples per day. So this is in line with the MOH mission of increasing the testing capacity of 16,000 tests per day. Okay, challenge number 2 is in terms of human resource. So with a rapid increase in the number of samples, definitely there was a demand for the lab staff to work longer hours, and this had caused some physical or emotional distress, because they have to do more on calls, they have to wear full PPE for a longer period, as well as emotional distress when dealing with highly infectious novel pathogen. Okay, so everybody was afraid of this unknown of this new pathogen. However, fortunately, this problem was addressed quite earlier on by deploying more staff from other sections, our own staff from other sections, to be involved in the COVID-19 test. So we deploy staff from other section. We give them on-job training of the molecular work so that it can widen the pool of molecular section. So in addition, there are also directives from Ministry of Health for mobilization of healthcare workers from other hospitals, enabling staff from for example, tutors from Institute Latihan Kementerian Kesihatan for the medical lab technologies to volunteer at the lab. So those outside Hospital Sungai Buloh came and helped us out, as well as contractual scientific officers and MLTs are also being roped in to do work in COVID-19, to do work in our lab. And last challenge is the technical challenges. So in the beginning, we did experience some technical issues with the COVID-19 test. Okay, and this is, I would say, quite expected because we are dealing with a novel virus which we do not know much how it behaves. Okay, because it behaves, the behavior is it can be unpredictable. So the test is also quite a challenge. For example, is it because of the test, does it fail because of the unstable probes, and then we need to go for optimization and changing the test protocol, so on and so forth. And these technical difficulties did affect the turnaround time and cause some degrees of anxiety among clinicians as well as us, okay, the lab. So fortunately, again, we did receive some assistance from the experts at our reference lab, our Institute of Medical Research, IMR, which helped to troubleshoot the relevant problems. And we still consult them whenever there is issue with our test kit that we are using now. And in addition, we still send our samples to them for sequencing as well as for viral culture. And this is done case-to-case basis. And again, we are lucky because many labs are doing COVID-19 tests now. So whatever problems that we have, we can share. We can ask their experience if they are using the same kit as well. And we are also participating in the external quality assurance program coordinated by our reference lab. So I think that ends my talk, and thank you very much.
Thank you very much, Dr. Tuan Suhaila. Are there any questions? Did anyone put up any questions? Tak ada ya? I don't think there are any questions. So shall we just go on because we are already running late.